The Health Ministry says it is working round the clock to control an outbreak of cholera in Busia district. The State Minister for Primary Health Care, Sarah Opendi, says the outbreak in Kampala, Wakiso and Mbale has been brought under control, but the Busia situation is being closely monitored.
Busia is generally a very dirty town. The drainages are all clogged. A lot of dirty water in the drainages. We've seen that most of the public places do not have toilets. The latrine coverage in Busia alone is 46%.
Already, the cholera cases here have risen to 221, and 6 people have died. At Busia Health Center, one of the people attending to 8 family members admitted there said the victims contracted the disease from a relative who had died recently. Opendi, who went to the worst-hit areas of Arubine and Marachi, blamed the outbreak to poor latrine coverage and failure by the authorities to enforce hygiene and sanitation.
They have the bylaws, but it's unfortunate that the enforcement is actually where the problem is. So we are going to work closely with the RDC, the RDC's office, the police, to ensure that they enforce those bylaws. First, by ensuring that all public places have latrines, and if they are not there, those public places need to be closed.
Most of the public places like the taxi parks and markets do not have toilets. Opendi also heard from the locals that there is a no man's land at the border between Uganda and Kenya where sewage flows freely. The World Vision has donated 9,000 gloves, medicated soap and beds, among other things, to the cholera isolation center in Busia.